Aloha! This CME activity is jointly provided by the Queens Medical Center and UH-Dabsum Department of Geriatric Medicine. As a reminder, evaluations are required for certificates of attendance. After you complete an evaluation, a certificate would automatically be sent to you. You can find evaluations by following the link in the chat at the end of the session or at any time on our website and email advertisement. For those who are asking for CMEs, the Queens Medical Center will be sending out CME transcripts in January of every year. We are on month 1 of a 4-month series on what matters. In our evaluations today, we will be asking you if your clients have an advanced directive, healthcare power of attorney, and post. About ECHO, we want to remind everyone that this is an ECHO webinar, which means that this session serves as a forum for mutual teaching and learning from experts and from each of us on the front lines. As the ECHO motto goes, all teach, all learn. So it will take all of you to create this community of learning. A little bit about our format. After a short lecture from our experts, we will share expertise from the rest of the team, and then open up the time for case discussions. We invite you to share any geriatric cases. It may even be on a topic not related to the topic of today's lecture. We only ask that you keep it HIPAA compliant, case for discussion. That means please do not share patient's name, birthday, address, and so on. We learn best from our patients. They are the best teachers. Our interdisciplinary team is here as well, and we will all be willing to teach and share our collective wisdom with you. Most of you already know me. I am Wynette Gaylord, president of ARCA, Care Home Operator Association. We have Maribel Tan, president of Foster Family Homes Association, Danielle DeLonghi from Aloha Care, Leila Ventar from United Healthcare, and our geriatrician, Dr. Rita Bell Fernandez from University of Hawaii. We recently finished a 4-month series on the mind. If you're interested in viewing any of those lectures, you can find them on our website. We cannot offer certificates of attendance for videos you have viewed. Unfortunately, you must participate in our education live. In month 2 of our 4-month series on what matters, we will be talking about what is palliative care. It gives me great pleasure to introduce our speaker, Dr. Rita Bell Fernandez. She is an associate professor at the Geriatric Medicine Department of the John A. Burns School of Medicine, University of Hawaii. She is a practicing geriatrician at Kalihi Palama Health Center and also is an associate medical director at Islands Hospice. She graduated from medical school in India in 1995 and moved to Hawaii in 1999 to study geriatric medicine at UH. Dr. Fernandez has championed home-based palliative care across the state and US affiliate Pacific Islands. Thank you so much. Doctor, take it away.
Aloha, everyone. I am so happy to be here with you all. And thank you for attending in such great numbers and bringing the primary and substitute caregivers, and everybody's attending these sessions. So today I want to do something different because I know you're going to say, Doc, we know about hospice. We already heard that talk before. So I wanted to make it a little different. So no more boring PowerPoint lecture. We're going to play a game. So this is, we're going to ask you some questions and put up a poll. And based on the results, I will give the answer, whether the answer is true or false. So we're going to go, oh, John, we have to do this one at a time. We have to do this one question at a time.
Oh, doctor, sorry. Yeah, could you instruct them just answer one at a time? Don't go to the next one.
Oh, we have
Oh, wait.
to.
Sorry, I made a big mistake here. I didn't realize.
Yeah, they are one question at a time with the poll results. There's separate questions. So let's try to, yeah, we have to do it one at a time.
Okay, yeah,
Maybe I'll start with the first one and you do the edits, John. Maybe you can edit this, take this off the screen. So we can go with the first question. Once a person signs on to hospice, they must die in 6 months. So that's the first question, and you can put the answer in the chat, whether you think that is true or whether you think that is false. So John, maybe we take this poll that you put up offline and you can
Okay.
do the
let
you
me
can
do that quickly.
correct
All
it.
right,
Thank you, John.
sorry about that.
No worries. We put a lot on your shoulders. So we're gonna take this poll offline and we're gonna say, I can see the chat. Everybody is saying false. Okay. All right. This group knows the answers. Great job. No one has said true, so that's good. Everybody in the chat is saying false. That is the correct answer is false. If a person signs on for hospice, they do not have to die in 6 months. I had a patient who once asked me, and the patient looked at me and said, Doctora, do I have to die in 6 months? So no, it's just a criteria for the doctor to certify that in the doctor's opinion, they think that the person has 6 months or less to live. Now, that doesn't mean the person got to die in 6 months. The person can die in 1 year, in 2 years. And I will tell you the longest. Can you guess what was the longest? The longest was 8+ years. 8+ years was a case that Hospice Hawaii had. And that person, every 6 months, they would recertify. So what's the meaning of recertify? It's like Costco. You know, when you go to Costco, every year you get a new Costco card. You got to renew your card. So in the same way, you can renew hospice. And every time you renew, the doctor will say, yes, they're still hospice eligible. Yes, if they go on like this, maybe they have 6 months or less to live. So that's very important to understand, that the patient does not have to die in 6 months. This is very important to understand. It's just a provider's estimation. It's a guess. It's only a guess and an estimation and a prognostication from the physician. And what happens is you can always recertify for another period. And when that period gets over, you can recertify for another period. So this can keep going on and on and on, okay? This is very, very important to understand. And the beauty of hospice is that hospice care is nearly free, right? There is little to no copay. What is the standard copay that you and I got to pay when we see a provider? Usually we got to pay 10-20%, right? We may have to pay $10, $20, $26 for a visit. But what happens in hospice, there is no copay or little to no copay. If you have a question, I'm going to encourage you to raise your hand. We can use the Zoom feature to raise your hand. Leonida, do you have a question for us? Yes, hospice is at virtually zero copay. It is covered by Part A of Medicare. And usually, so what happens? You may say, so doctor, can you keep going on with this 6 months, 6 months, 6 months, 6 months forever? Yeah, either two things can happen. One is a miracle can happen. That means your client can get better. Wow, good for you. Graduation. So what happens when the client really gets better, they graduate and they sign off hospice because maybe their cancer got cured. Maybe their blood test got much better, their kidney got better. So they can graduate, or if they continue like this, maybe ultimately they may pass away. So if they die, then that's when hospice ends. So remember, this is paid by Medicare, and it either ends at they graduate from hospice or they pass away. So that's how the story can end with the client. What if there is a question here from Mayanne? Mayanne says, what if the patient doesn't have Medicare? Now, the good news is that every other insurance, they follow Medicare rules. So Medicaid, every client with Medicaid, whether they have Aloha Care, Kaiser, United Healthcare, Ohana, it doesn't matter. HMSA, Medicaid covers hospice. Even the private insurances cover hospice. So this rule, what I'm telling you, this 6 months or less to live is the same rule. Doesn't matter if the patient has Medicare or any other insurance plan. So any questions about this 6 months or less, you can put it in the chat and I will answer your question on this point. John, how are we doing? Shall we put up the second question all by itself? Okay, let's go here. Now we have a question, and John is going to play us some music as well to give you all. We have 102 participants, or more than 102 participants. So let's have some music to time our poll.
Jeopardy music.
Okay, we will not use the chat anymore. We'll participate in the poll and we'll put the answers in the poll. So I'm going to end the poll and share the results. The results say most of you, 77% said this is false. One person says they don't know the answer to this about going back to the hospital or not. And 21% said it's true, they cannot go back to the hospital. So I want to answer this question because this question is a little tricky. When a person signs on to hospice, they are signing on for that terminal diagnosis. For example, if the diagnosis is cancer, then they are signing on to hospice for everything related to their cancer. But they still have their Part A Medicare, which covers hospital benefits for all the other conditions. So I will give you an example of my own patient at Kokua Kalihi Valley. I had a Laotian lady who lived in the camp for housing. She used to go collect cans and walk around and do so many things. But when she was in hospice, she fell down and broke her hip. And guess what? we could get her back in the hospital for the hip replacement, because this was a fully ambulatory lady and her Part A Medicare was available. She did not have that she could never go back to the hospital. So the answer is yes, Medicare will pay for the hospital. Now, what if it is related to the hospice diagnosis? Now that is when it becomes a little tricky, and we often need the blessing of the hospice companies. Now, many hospice companies, they have inpatient beds. They have inpatient beds at Castle, at Queens, and you also have something called an inpatient benefit of hospice. So it's called the GIP, general inpatient. So if the person, for example, is enrolled for heart failure and maybe they were very short of breath, we can bring them inpatient under the GIP benefit and can improve their shortness of breath with IV medications. Maybe their pain cannot be controlled. It could be a cancer patient and they need the general inpatient benefit for pain control. So the answer is yes, it's a little tricky, and you have to work with the hospice provider to see if it is going to be covered by them or if it is other parts. If it's unrelated, the typical Medicare Part A will cover the hospitalization. Yes, life-threatening situations, patients can go to the hospital. Now, remember, the hospice company will tell you to call them first, because you need to call them so they can advise you. They tell you, don't call 911 first, call them first, because they answer the phone even in the midnight, 2 in the morning. There is someone to answer the phone. And Angel brings up a very important point. You can revoke hospice if it's not covered. So if you have hospice, remember, you can stop and revoke hospice anytime. Just like if a patient came to see me and I'm the PCP, they can tell me, Dr. Fernandez, you're fired. We're going to find another PCP, right? They can always change their mind. They can always revoke. So that power is there with the patient and family. All right, any questions on this poll? You can put your questions in the chat, and we have Danielle from Aloha Care who will facilitate your questions in the chat. So Angel brings up a point. You can admit again if the patient is discharged from hospital, and that's true. And the hospice companies will calculate how many days are remaining in that benefit period. There's some calculation they got to do, and they will tell you when the patient can be brought back on again. All right, we'll stop sharing on this one, and we will go to the next question. John, maybe we'll put up the next question. Next poll. So please answer the poll. Once a person signs on to hospice, they cannot see their specialists. John, you can give us some music as well. Thank you, John.
Yep, we have some answers in the chat there.
Okay, I'm ending this poll. Once again, we have a lot of people that know the answer to this question. Once a person signs onto hospice, they cannot see their specialist. That is false. Okay, so I want to tell you a trick. How can they see their specialist? And if, for example, a person has cancer and they want to continue to follow up with their oncologist, even if they're not getting any more chemo and no radiation and it's all POW, they still want to see their oncologist once in a while. It's one easy way to do this is the oncologist can be the hospice attending of record. If the specialist is the hospice attending of record, there is no problem. It's very easy. They can bill the insurance and there's no confusion in getting paid, and the doctor will get paid. The problem that happens is sometimes the doctors, they don't know how to bill correctly. They have to use a modifier. What does the modifier do? It is telling the insurance like Aloha Care, HMSA, they're telling the insurance that this oncologist is not an employee of the hospice company. They're not working for a hospice. They're seeing the patient in their office, in private practice or group practice in the community. So if the specialist bills correctly, it's very easy to get paid. What if the specialist is not the attending of record? So for example, somebody has a urologist and now their Foley is giving them trouble and they want to see that urologist again. Then the hospice got to cover for it. If that doctor is not the attending of record, then the hospice company got to pay that visit charge. So you have to remember there's two choices. Either the hospice is going to pay or the insurance is going to pay. If we want to run it through the insurance, the easiest way is to have the specialist as the hospice attending of record. So can their clients still see their psychiatrist? Yes, because any diagnosis that is not related to hospice, you are free to see your doctors. You can follow up for bipolar, depression. These are not hospice diagnoses anyway. So clients can see their other doctors that have nothing to do with hospice, and they're free to follow up with their specialists. So remember, people are not giving up their doctors when they come on to hospice. Danielle, is there any question that I missed in the chat on this topic?
No, it sounds like Claudia is having a hard time with the polls. So she might just have to give her answer in the chat.
Okay, sounds good. All right, John, we will go to the next question. Here is the poll and the music. Wonderful. This group knows all the answers. 89, 90% got this correct. So once a person signs on to hospice, No, it's false. They do not have to stop all their regular medicines, okay? Sometimes if people have swallowing difficulties and they're choking, and if death is imminent, maybe the hospice might stop the medicines. But for the most part, people do not need to stop and give up their medicines. You don't have to give up your doctors. You don't have to give up your medicines. So the question is, who will pay for these medicines? And Angel has put this in the chat. If it's related to the hospice diagnosis, then hospice will pay for the medicine. So, for example, if it's a cancer diagnosis, then hospice will cover medicines related to the pain, nausea, vomiting. If it is unrelated to the hospice diagnosis, so say if it's a cancer patient and they have blood pressure problems, then the blood pressure medicine will come through Longs or Walgreens. It will be paid by the insurance. So the long and the short is people do not have to give up their medicine because they think, oh, I joined hospice and all I get is morphine. Many people think that's what's going to happen. I go to hospice and they only give me morphine. No, that's not true. You can continue all your medications. Thank you for that. We'll end this poll. And John, we can put the next poll. Persons living alone with no caregiver are not eligible for hospice. Okay, let's look at these results. Yeah, 93% got the answer correct. Persons living alone are not eligible for hospice. This is false. People can still get hospice benefits and be enrolled in hospice even if they are living alone. But what the hospice company has to do is have a plan. They need to have a plan in case the patient deteriorates, in case they can no longer live alone. Then the social worker has made a plan B, a plan C, that maybe then the person will be willing to go to a nursing home or willing to go to a care home or a foster home or move in with their daughter, or a family member from the mainland will come to stay with them. As long as there is a plan, as long as the client will remain safe, yes, we can sign up people who are living alone for hospice. So 93% of you know the answer to this one. Really great job. So I'm very pleased. We can stop sharing and go to the next poll. So the question here is, persons receiving tube feeding are not eligible for hospice. True or false? Okay, we will end the poll and share the results. Wonderful, 96% got this correct. Person receiving tube feedings are not eligible for hospice. That is false. So we can still sign on people who are on PEG tube feedings for hospice, okay? They don't have to stop tube feeding just to sign on hospice. Same way with a ventilator patient. They don't have to get off a ventilator to sign on to hospice. Now, yes, the team may have a plan saying if the patient cannot tolerate the tube feedings, we will decrease the amount, and maybe the family doesn't want this to go on forever. They may look at the advanced directives and see the goals of care of this patient and determine whether they want to do a taper of the tube feedings, and based on how much the client is able to tolerate these tube feedings. So again, this is all in the plan of care. But to sign on to hospice, the patient doesn't have to give up or get the PEG tube pulled out, okay? This is important, and I'm glad all of you know the answer to this. 96% of you got this correct. People who are receiving tube feedings, they can also get hospice. Thank you. We will go to the next poll. What about Ensure? Yes, Ensure is a type of formula. So thank you. Please put any questions related to these poll questions. Please put it in the chat. So what about Ensure? People can get Ensure orally, or sometimes they get these preparations through the PEG tube. Usually this is covered by hospice. Hospice will provide the tube feeding formulas. So patients can have Ensure, can have Boost. Many clients are given supplements, especially if their appetite is poor, if they're losing weight. Often the hospice companies may provide this free of cost. So yes, they can provide Ensure and they can continue taking Ensure. So we are now moving to the next question. Our next poll. Our poll question is, hospice is only concerned with the terminal diagnosis, true or false? Okay, we are sharing the results to this question. Hospice is only concerned with the terminal diagnosis. 16% said true. The answer is true. Hospice company deals only with the terminal diagnosis. So for example, we don't tell them, sorry, my dogs are barking. The hospice company will not be doing physical therapy for the arthritis. They will not be taking care of the blood sugar for diabetes and ordering the glucometer. They will not be doing the blood test for the thyroid. All these other diagnoses are managed by the PCP. The primary care doctor will handle every other diagnosis. So the hospice is concerned with the terminal diagnosis. So anything related to the terminal diagnosis, it is their business. So what about pain? If the person has cancer, and they have pain, yes, the hospice will manage the pain. If the person has heart failure and patient is short of breath, hospice will handle the shortness of breath, the chest pains for anybody related who is admitted for cardiac diagnosis. Pain and bowel regimen is typically managed by hospice because hospice gives opioids for pain management, and one of the side effects of opioids is constipation. So again, because that is related to the terminal diagnosis, it is covered. But if something is not related, like, can I have my thyroid level checked? I'm on Synthroid. That is not the hospice company's business to be ordering the blood test for the thyroid. That is the PCP's job to do that. So we have to remember there is the terminal diagnosis and there's all other diagnoses. I will give you a case, a real case of mine, patient from the Federally Qualified Health Center. So the patient had lung cancer and was in hospice for the cancer. But they also had dialysis for the renal failure, which was because of diabetes. They had diabetes that was really bad and their kidneys failed and they want dialysis. So could they get dialysis? The answer is yes, because it was not related to the terminal diagnosis. The kidney failure was very different and separate. So the terminal diagnosis here was cancer. So there's a question. What about if
Arthritis.
pain is
Mhm.
due to arthritis? It depends. Maybe if it is purely arthritis and not related to their terminal condition, then the patient would get their arthritis medicine from Long's Drug, from Walgreens Pharmacy, and they would continue with their orthopedic management of their arthritis. There are people who have rheumatoid arthritis and they see a rheumatologist or an orthopedic doctor. So whatever is being managed by those specialists would continue. It would not have to stop. I know people have more questions on this. So is hospice going to be concerned? It depends if arthritis was related to their terminal diagnosis or not. There was a question earlier about the tube feeding. If a client is on hospice and they change their plan, I don't know whether you mean the advanced care directive and get tube feeding. Often it is harder to start tube feeding. Like if a client never had tube feeding and suddenly stopped eating, that would be more difficult to say, now I want a peg tube place. I got to go to the hospital to get a peg tube placement and start tube feeding. Often that may not be aligned with the goals of care. But if a patient already had tube feeding and signed on to hospice, they don't have to give it up. They don't have to stop the tube feeding. I hope I answered that question, Norma. Hospice does cover comfort care. So usually 90% of the time, you will get Tylenol and all of these things in the comfort pack. So they cover nausea medicines, anxiety medicines, pain medicines. Most hospice will give you as part of the comfort pack. But remember, hospice is for the terminal diagnosis. If you have other needs, you need to get it from the primary care doctor to manage blood tests, medicines, and DME or other orders related to the different diagnoses. Okay, we will move on to the next poll, John. The next question. Doctors, nurses, social workers, chaplain, home health aide, bereavement coordinator are all part of the hospice team. True or false? Okay, here are the results. 96% said true. Yes, this is all the hospice team. It is the most beautiful care coordination you can receive in the United States today. There is no other company that can offer you all of these wonderful team members at little to no cost, at little to no copay, all coming into your home. It will come to your care home, they will come to your foster home, and you get this beautiful team. Doctors, social workers, nurses, nurse practitioners, chaplain, home health aide, bereavement coordinator. Now, it's like the colors of the rainbow. The rainbow is only as beautiful as you can see all these lovely colors, right? So what if the rainbow was only blue? Would the rainbow be pretty if we only had one color rainbow, then 7 color rainbows? So in the same way, if you want the best of hospice services, please take the full team. Don't say, I only want the nurse. No, thank you to the rest. Take the full rainbow. It's like I told my caregiver patient, I said, I'm giving you a buffet. I'm giving you the poo-poos, the chicken, fish, pork, adobo, dessert. Don't tell me you only want chicken. Please take the full beauty of this team. It works very well if you take the full services, okay? The full services are completely free. And remember, the chaplain, they are really good to talk story with the patient because the patients are lonely. They need someone to talk to. But often families say, no, I don't want chaplain because they think somebody's going to convert them to some other religion. No, the chaplain is here not to talk about religion and make you convert to something. The chaplain is more to bring peace, to help people who are suffering. Thank you. Angel explains to families, it's great, that it's not about religion. So let's, I have another question here from Carolyn Lazo. Can you discuss the different levels of hospice care? Okay, so supportive care is different. It's not hospice care. It is a type of palliative care. Like we had our speaker last month, Dr. Morita. She explained that was palliative care. So in hospice services, 90% of the hospice services are coming to the home. So it is routine home care level of care. There is something called continuous level of care if a nurse is needed for a greater part of the day. There is also something called the respite level of hospice care. So say if a family had a wedding or they had to go somewhere, hospice may pay for up to 5 days and take the client and put them in a nursing home or another facility and give the respite to that family. There's also the general inpatient benefit. So there's inpatient, there's home, there's continuous home, and there's respite. These are the different levels of hospice care. But the one that we see the most common is the routine home services and the team coming to the home. Any questions about these team members? Often the home health aide, they can do massage, they can do namaste care. If the client doesn't need bathing, you don't have to take them for the bathing. You can also say, okay, maybe some massage will be nice. Okay, John, we can move
No
on.
questions.
Yes, go ahead.
Oh, no, no questions.
John, let's put up the next poll. Thank you. Here is the question. Case management fees for care homes may be waived since hospice provides case management. Okay, here we're going to share the results. We are split on this. 16% says it's true, 74% said it's false, and 9% said they don't know. So I will tell you, in my own practice, I was successful in getting the case management fees waived. And the family did not have to use and pay $500 a month to the case manager if Department of Health is willing to accept the paperwork from the hospice company. And I'll never forget this case because I was doing home visits and the client was in a care home in Kalihi. And I used to do home visits every 2-3 months, go visit. And the mother had end-stage Alzheimer's disease. And I was always telling the daughter, she would meet me, she would come from when I was visiting the home. And I would tell the daughter, you know, your mother qualifies for hospice. She is at the end stage of dementia. And the daughter would say, oh, no need, doc. It's okay. No need, no need. And she kept telling me no for hospice. And this went on and went on and went on. Because I think for the family it was no different because care is being provided by the care home. Till one day I told the daughter, I said, you know what? Your family's paying this money out of pocket. We could save that money for you. The case management can be picked up by hospice and they can turn in the paperwork to Department of Health and Department of Health is willing to accept that. So when I said that, then the daughter agreed. And then she changed her mind and she said, okay, I will sign up because that's like, if you look at $500 a month, that's $6,000 in a year. You could go on a nice holiday. And the daughter then signed up, and I'll never forget, she had a friend in St. Francis Hospice, and she said, Dr. Fernandez, I'm going to go where my friend is. And then her mother got signed on to St. Francis. And I've seen this done, and there is certain paperwork that is needed that the hospice company will provide that paperwork. And typically what happens is the care plan, the interdisciplinary team notes, patients are discussed every 2 weeks. Every 2 weeks, every patient in that hospice is discussed in a team meeting with the physician's supervision. So the medical director goes over every single case, and our Department of Health is willing to accept that care plan and the interdisciplinary team notes for case management purposes. So The answer is true for this one. It's possible and it has been done before.
Okay, Dr. Fernandez, this is Juanette. I would like to go ahead and just interject really quickly, but before they go ahead and state to the family that they are going to go with the hospice, they need to request a waiver from Department of Health first and get a letter back saying that it is okay to go with the hospice for case management.
Awesome. Thank you, Juanette. That's why we have such an amazing hub team. It takes a village, and I thank Juanette and Maribel Tam and all our experts on the hub team that are here to provide education and mentoring to everyone. Thank you, Juanette, for bringing up that important point. Mahalo.
You're welcome.
Mayanne says, some hospice companies don't want to do the paperwork. That may be true. Some hospices don't, but remember, you have choice. You have 5 companies today on Oahu. So there is choice and you're free to change. Some places we have no choice. We only have, for example, HECO. We have 1 electrical company, but you have 5 hospice companies on Oahu. So remember that you have choice. Okay, John, maybe we can have, is there any more poll questions? All right, our final question. Hospice companies provide support to families 12 months after death. Okay, let's look at this answer. We are a little split in this one. Hospice companies provide support to families 12 months after death. 56% said true, 25% said false, and 19%, we have some honest people here that I don't know the answer to this one. So the answer to this one is true. Hospice companies provide bereavement support as per the hospice Medicare rules and guidelines to provide and stay with families and support them all the way 12 months after a person passes. And this is crucial because just imagine there's so much attention to the patient while they're going through this difficult period. And when they pass away, it's like the families are all alone. All those phone calls, all those visits, they stop. But the bereavement support is awesome because the bereavement coordinator, they can work with the clients and they can work with them to help them through a difficult period and just make sure the caregiver, are you okay?
There's a comment from Angel about holidays. Yep.
Yes, holidays become extremely hard. And some caregivers, they go into depression and it's very hard. Their grief can turn into complicated grief and depression. So it's really crucial to think about hospice can support families even after death.
How often are they following up after death? Is it like every week, every month, every 3 months? Is it different for every hospice or every situation?
Yes, sorry, my cuckoo clock is singing. Yeah, it all depends on the caregiver. Like some caregivers need much, much more support than another caregiver. So it could be weekly phone calls, and for some who are doing fine, it could be monthly. So it is greatly individualized based on the family's needs. And they do some other beautiful things like Memorial Day, Veterans Day. They invite the caregivers, and they have this memorial for life and other ways to help them grieve appropriately. Yes, that's another important point. Depends how they cope with the patient's passing, and depends also how the passing was. So it's greatly individualized on how much support. Daniel, maybe you can read the question.
Sure, I'll read it. It says, Doctor, the only problem with hospice agencies like Islands Hospice, they limit supplies, which leaves caregiver shortage with what the client needs. Like diapers, it sounds like they give 1 bag or 20 pieces per week. When we ask for additional, they say we have to ask our supervisor first, where the fact the client used to receive their proper supply from the regular insurance before. What is the suggestion or remedy for this kind of situation?
Okay, so the remedy for this situation, it's back to what is the hospice diagnosis. So like I can give you an example where the diapers may not be related to the hospice diagnosis. Say a person has cancer, but this patient has years and years of quadriplegia. Maybe they had cerebral palsy as a child, and they had that for years, and they were getting their diapers through the developmental disabilities through their Medicaid. So if that supplies was from a different diagnosis and coming out from their insurance, that would continue and not move on to the hospice company, because hospice is only concerned with that terminal diagnosis. But if you are falling short, and if it's related to the diagnosis, you need to bring it to the attention. And yes, if that doesn't work, then please call up and speak with the supervisor yourself, so you can make sure you get adequate supplies that you need. Lila, I'll let you take over and conclude the remaining slides, please.
Okay, well, thank you everyone for attending. Just a reminder to please complete your evaluation and ensure that we have your correct email address. When you do the evaluation, please ensure that you are answering those questions that popped up in the earlier slides and as covered by earlier in the beginning of this presentation. And your evaluations will be emailed to you. And again, thank you so much. Yes, the website will be in the chat. And thank you so much for attending. We are aware that you are very busy providing great care to our members, and we just want to appreciate you for that. So you guys have a wonderful rest of the week.
There was a question about if you are getting the supplies from hospice, you cannot call the insurance for supplies. That is correct, because if it's for the diagnosis, if it's related to the hospice diagnosis, then all the supplies will come from the hospice. So if you're not getting enough, you need to bring it to their attention. You need to complain. Much mahalo. Thank you all for participating in the poll, and thank you to John, who did an amazing job with our game and our music. It's not easy having a game show on Zoom. Thank you, everybody. Great job.
Thank you, Dr. Fernandez. Thank you, Laila. Thank you, John. Bye-bye.
Mahalo, Cherise.
Thanks. Bye.
Bye.